Welcome to the What Does Science Say channel. Today we're embarking on a deep dive into a health topic of, well, immense importance, especially for men and individuals with male reproductive organs, prostate cancer. Our goal is to cut through the complexity and deliver clear, actionable insights. We'll cover everything from what the prostate is, common issues, symptoms, diagnosis, treatment pathways, and, vital lifestyle factors like diet.
It's truly a conversation everyone should hear because the statistics are, well, they're quite striking. About 1 in 8 people with a prostate will actually get this diagnosis in their lifetime.
1 in 8.
And for Black men, that figure jumps significantly. We're talking 1 in 4 lifetime risk.
Wow.
So our mission today is really to clarify the facts, maybe address some common misconceptions, and empower you with knowledge so you can make informed health decisions.
Okay, so let's start with the basics then. What exactly is the prostate?
Right.
It's a small gland, I understand, situated just below the bladder, and it wraps around part of the urethra. Its main role is reproductive.
Exactly. Its primary role is reproductive. It produces the seminal fluid, which is, the stuff that nourishes and transports sperm.
Got it.
And what's crucial to understand here is that prostate cancer starts when cells in this gland begin to grow and divide uncontrollably.
Okay.
It's actually the second most common cancer worldwide among men. Nearly 200,000 Americans are diagnosed each year.
200,000, that's a lot.
It is. And while it's widespread, affecting about 1 in 8 men, as we said, it's important to recognize that prostate cancer often progresses very, very slowly.
Slowly, okay. That's key.
Yes. In fact, by the time men reach age 80, something like 80% of them will have some form of prostate cancer cells present. It's just that these cells often don't cause problems.
100% by age 80.
Yeah.
That sounds like a huge number, but I guess the key takeaway, the good news maybe.
Well, the good news, and this is vital to emphasize, is that the vast majority of prostate cancers are highly treatable and often curable, especially when they're identified early and are still confined to the gland itself. That really changes the conversation around prognosis.
Right. Early detection is critical then, which leads naturally to the question, who is most at risk?
Yes, a fundamental question. So several factors come into play. First, age. It's a primary factor.
Okay.
Your chances increase significantly as you get older. It's most commonly diagnosed after age 50, and over half of all cases occur in individuals over 65.
So age is definitely number one. What else?
Family history. This plays a considerable role. If your biological father, brother, or son had prostate cancer, your risk basically doubles or triples.
Doubles or triples? Wow.
Yeah. Oh, and the younger they were when they were diagnosed, and the more first-degree relatives affected, the higher your personal risk climbs. This hereditary link can account for maybe up to 15% of cases.
15%?
And interestingly, a family history of breast cancer, say in your mother or sisters, can also increase the risk.
That is interesting. I wouldn't have necessarily connected those.
It points to some shared genetic pathways. Then there's race. And this is a significant and, frankly, concerning factor.
The 1 in 4 statistic you mentioned earlier.
Exactly. Black men and Caribbean men of African descent face a disproportionately higher risk, that 1 in 4 lifetime risk, compared to 1 in 8 for other men.
And it's often more aggressive too, I believe.
That's right. Their cancer is also often diagnosed at a later stage, tends to be more aggressive, and unfortunately is more deadly. We also see higher mortality rates in Native American men compared to white men.
Okay.
Conversely, men of Asian descent generally have a lower risk. But, and this is fascinating, if they immigrate to the U.S., their risk increases over generations.
Which really points towards...
Environmental and dietary influences strongly suggest that. It's not just genetics.
Right. Are there other factors besides age, family history, and race?
Yes, definitely. Being overweight or obese and smoking are also consistently identified as increasing risk.
Okay. So that racial disparity, especially for Black men, it's really striking. Are we getting closer to understanding why? Is it purely genetics or...
It's complex. Genetics are certainly involved, but research points strongly towards a mix of socioeconomic factors, differences in access to healthcare, maybe chronic inflammation, and those environmental influences we touched on.
So a combination of things.
Exactly. It's not a simple answer, but it absolutely highlights why awareness and proactive screening are so important in these communities. But, it's crucial to remember while these risks exist, prostate cancer can affect men from all backgrounds. Awareness is key for everyone.
Absolutely. So let's shift to symptoms. You mentioned it can be tricky because early on there might not be any signs.
That's one of the biggest challenges. Early stage prostate cancer rarely causes noticeable symptoms. They usually only appear as the disease progresses or if it starts to spread outside the prostate.
And the problem is these symptoms can mimic other things.
Precisely. The real challenge is that many potential prostate cancer symptoms overlap significantly with other very common non-cancerous conditions. Things like benign prostatic hyperplasia BPH, the common enlargement of the prostate, or prostatitis, which is inflammation.
Okay, so what are some of those common symptoms people should, maybe keep an eye out for?
Sure. Common indicators often involve changes in urination, things like a slow or weak urine stream,
Okay.
or a flow that starts and stops, maybe needing to urinate frequently or urgently, especially noticeable at night.
Getting up multiple times at night.
Exactly, or feeling like you just can't empty your bladder completely, maybe some dribbling afterwards.
Mm.
Other potential signs could be pain or a burning sensation during urination, or maybe unexplained pain down in the prostate area, particularly when you're sitting.
Right.
Difficulty controlling your bladder, or sometimes even bowel movements. Some men might experience painful ejaculation, difficulty getting or keeping an erection, or notice blood in their semen or urine.
Blood is usually a sign to see a doctor regardless.
Right. Absolutely. Always worth getting checked out. And then, if the cancer has progressed further, it might cause persistent pain in the lower back, hips, or chest, maybe numbness in the legs or feet, or even unexplained weight loss and fatigue.
So quite a range of things. But you mentioned BPH and prostatitis. How common are those?
Extremely common. Most men, as they age, will experience some form of urinary trouble. Very often, it's just BPH, that benign enlargement. It affects up to 90% of men in their 80s.
90%.
Yeah. And crucially, BPH is not cancer, and it doesn't increase your cancer risk. Prostatitis, the inflammation or infection, can also cause similar symptoms, maybe blood in urine, pelvic pain, sometimes fever. Usually it's bacterial, responds to antibiotics, but it can become chronic sometimes.
So it sounds like many of these symptoms are just incredibly common with aging, even without cancer being involved. For someone listening, what's the trigger? When does it move from I'm just getting older to I really need to see a doctor?
That's the million-dollar question, isn't it? It's really about persistence and maybe a cluster of symptoms appealing together, especially if they're new for you or seem to be getting worse.
Okay, persistence and clustering.
Right. None of these symptoms alone is a surefire sign of prostate cancer. But if you're experiencing several of them, or you have known risk factors like that strong family history, or if you're a Black man over 45, it's always, always a wise step to visit a urologist or your primary care doctor, have that conversation, get evaluated.
Makes sense. So if someone goes to the doctor with these concerns, what's the typical diagnostic path look like?
Well, after discussing your symptoms and risk factors, the first steps usually involve specific tests.
Okay.
The most common starting point is often the PSA test. This is a blood test measuring prostate-specific antigen, a protein the prostate gland makes.
Right, the PSA. I've heard a lot about that one.
You probably have. An elevated PSA can indicate prostate cancer, but, and this is a big but, it can also be raised by many non-cancerous things.
Like what?
Infections, inflammation like prostatitis, just having an enlarged prostate BPH, even vigorous exercise like cycling or recent sexual activity, or simply getting older can raise PSA.
So a high PSA doesn't automatically mean cancer.
Not at all. Many men with a high PSA do not have cancer. It's really important that your doctor explains the pros and cons of this test thoroughly so you can make an informed decision about having it and interpreting the results.
Good point. What else might they do?
They might perform a digital rectal exam, or DRE. It's a quick physical exam where the doctor feels the prostate through the rectal wall to check its size, shape, and consistency for any hardness or lumps.
Okay.
And increasingly, an MRI, magnetic resonance imaging of the prostate, is becoming an incredibly valuable tool.
More so than the PSA or DRE.
In many ways, yes, it gives a much clearer picture of the prostate structure and can often detect significant cancers much better than PSA or DRE alone. It's particularly useful for assessing your personal risk more accurately.
Interesting. So PSA, DRE, maybe an MRI.
Hmm.
But how do you get a definitive diagnosis?
The only way to definitively diagnose prostate cancer is with a biopsy.
Right.
This involves using small, thin needles, usually guided by ultrasound, to take tiny tissue samples from different areas of the prostate. These samples are then examined under a microscope.
And if the MRI showed something specific?
Then they can do what's called an MRI fusion biopsy, where they use the MRI images to target the suspicious area directly during the biopsy, which increases accuracy.
Got it. What about general screening guidelines? When should men start thinking about this?
It varies. For individuals considered high risk, again, strong family history, African American descent discussions about PSA screening might begin in their 40s.
Okay, earlier for high-risk groups.
Yes. For most others, it generally starts sometime in their 50s. But the absolute crucial point here is to have a personalized discussion with your doctor. It's not one size fits all. You need to talk about your specific risks, your overall health, your values, and decide together when and if screening is appropriate for you.
That personalized approach seems really important, especially with something like the PSA test, which you said can be a bit of a double-edged sword, useful, but prone to false alarms. What should that conversation with the doctor really focus on?
It should absolutely focus on your personal risk factors, your own comfort level with potential outcomes, and understanding what a high PSA might actually mean in your specific context. It's about shared decision-making, not just getting a number.
Okay. And I think I've heard sometimes if the PSA is high, doctors might also check testosterone levels. Why is that?
That's a great point, yes. Checking testosterone can add another layer of information. If your PSA is rising while your testosterone is high, that might suggest a different situation than if your PSA is rising when testosterone levels are already low. The latter could sometimes indicate a more aggressive, maybe hormone-resistant type of cancer. It just helps build a more complete picture.
Ah, I see. Adds context. Okay, so let's say a diagnosis is made. How do treatment options vary? What influences those choices?
Treatment is highly individualized. It really depends on several things. The cancer stage, is it localized just in the prostate? Has it spread nearby, locally advanced, or has it spread further, metastatic?
Okay, stage is key.
Stage is key. Also, the cancer's grade, which is often described using the Gleason score. That score, usually from 6 to 10, reflects how aggressive the cancer cells look under the microscope. A lower score means less aggressive.
Grayson score, huh?
And then, of course, your overall health, your age, and your personal preferences are hugely important factors.
So what are the main approaches?
Well, for low-risk, slow-growing cancers, or perhaps for older men with other serious health issues and limited life expectancy, active surveillance or watchful waiting is often the preferred route.
So not immediate treatment.
Exactly. It involves careful monitoring, regular PSA tests, maybe periodic MRIs, sometimes repeat biopsies, but avoids immediate treatment and its side effects. Many men can stay on active surveillance safely for decades, potentially their whole lives.
That's reassuring for those low-risk cases. What about when treatment is needed?
Then we look at local treatments, therapies aimed directly at the prostate itself.
Okay.
The mainstays here are surgery, typically a radical prostatectomy where the entire prostate is removed, often using minimally invasive robotic techniques now, which helps with recovery. And radiation therapy. This can be external beam radiation using high-energy rays from outside the body over several weeks, or brachytherapy, where tiny radioactive seeds are implanted directly into the prostate.
Are the side effects better now with radiation? I know people worry about that.
They are improving significantly. Modern techniques, for example, using a special hydrogel spacer to push the rectum away from the prostate during radiation, have greatly reduced the risk of serious bowel side effects. Short-term effects like fatigue and local soreness are common, but manageable. Long-term potential impacts can still include sexual dysfunction or urinary issues, but they're less frequent or severe than they used to be.
That's good to know. Any other local options?
Yes, there are also newer approaches sometimes called focal therapies, like cryotherapy, which uses freezing temperatures to destroy cancer cells, or HIFU, high-intensity focused ultrasound, which uses focused heat. These can be options for certain localized cancers, often aiming for fewer side effects.
Okay. And what if the cancer is more advanced?
Then we move towards systemic treatments, therapies that affect the whole body. The main one here is hormone therapy, also called androgen deprivation therapy, or ADT.
Hormone therapy.
Mm.
How does that work?
It aims to reduce the levels of male hormones, like testosterone, in the body, because these hormones often fuel prostate cancer growth. ADT can put the cancer into remission, sometimes for years, and control symptoms very effectively, though it's generally not considered curative on its own for advanced disease.
Right. Are there other systemic options?
Yes, if hormone therapy stops working effectively, or for certain types of advanced cancer, chemotherapy and newer immunotherapy drugs are available.
Okay. And sometimes treatments are combined.
Absolutely. For higher risk localized cancers or locally advanced disease, combining local treatments like radiation or surgery with systemic treatment, usually hormone therapy, often significantly improves the chances of a cure.
So lots of options. But given those really impressive survival rates you mentioned earlier, 99% at 5 years, 98% at 10 years, it seems like for many men, the conversation must shift. It's not just about survival, but about balancing that treatment with quality of life afterwards.
That's precisely the critical conversation, especially because prostate cancer is often slow-growing and highly survivable.
Right.
With such high survival rates for localized disease, the focus very often becomes managing potential side effects impacts on urinary function, sexual function, bowel function, while still effectively treating the cancer.
How do doctors help patients navigate that? Those must be really personal choices.
It requires a very detailed, open discussion between the patient and their entire care team. You have to weigh the specific characteristics of the cancer, the patient's age, their overall health, and crucially, their personal values and preferences regarding potential side effects versus the aggressiveness of treatment.
Shared decision-making again.
Exactly. And it's worth reiterating just how positive the overall prognosis is. The American Cancer Society stats are remarkable. 5-year survival, 99%, 10-year, 98%, 15-year, 94% for all men diagnosed across all stages initially.
Incredible.
It really does reflect that saying you sometimes hear. More men die with prostate cancer than from it, particularly for those lower risk, slower growing types. Even if it unfortunately spreads, say, to the bones, survival is still relatively good compared to many other metastatic cancers, and treatments are available to control it, often for many years.
That's incredibly reassuring.
Okay.
So, okay, if so many men live with it, and the prognosis is often so good, what does this mean for our daily lives? Are there proactive steps we can take, particularly with lifestyle and diet, to maybe tilt the odds in our favor, either for prevention or managing it if diagnosed?
This is where we really get into empowering choices, things you can control, and the evidence is compelling. There was a major 20-year study published in the European Journal of Urology back in May 2022.
Okay.
It followed 12,000 men, and it revealed something quite profound. While lifestyle didn't seem to significantly change the chances of getting prostate cancer in the first place,
Like the incidence.
it had a dramatic effect on the risk of dying from it. Mortality. Poor lifestyle choices led to mortality rates that were 2 to 4 times higher.
2 to 4 times higher,
Yeah.
just from lifestyle.
Yes. And even for men who had a genetic predisposition towards aggressive cancer, adopting a good, healthy lifestyle could radically reduce their chance of dying from the disease by as much as 80%.
80%. That is a massive, massive impact. Okay, so what were those key lifestyle factors? What can we actually do?
It really highlights the power we have. The study validated 6 key factors: First, quit smoking. Smoking is consistently linked to more aggressive forms of prostate cancer.
Okay, number one, quit smoking. Makes sense.
Number two, regular exercise. And this isn't just about cardio. It's specifically mentioned including resistance training, weightlifting.
Why resistance training?
It helps counteract that age-related muscle loss, which boosts your metabolic rate. Plus, there's evidence it improves things like memory, too. It's good for overall aging.
Got it. Exercise, including weights. What's next?
Third, maintain a healthy weight. We already mentioned obesity is a risk factor, so focusing on weight management, using effective strategies, maybe even newer medications if appropriate, is beneficial.
Okay. Smoking, exercise, weight. What about diet? That seems like a huge area.
It is. Diet is factor number 4, and it's complex, you're right. There's some conflicting information out there depending on the source, but the overall direction is pretty clear.
What's the main principle then?
The overarching principle is really to embrace an anti-inflammatory, predominantly plant-forward way of eating. Focus on whole, unprocessed foods.
Plant forward. Okay. Can you give some key examples of foods to embrace?
Definitely. Tomatoes, especially cooked tomatoes, are standouts. They're rich in lycopene.
Lycopene. Right, I've heard of that.
It's a powerful antioxidant linked to reduced prostate cancer risk, potentially reducing prostate size, and even slowing tumor growth. Think tomato sauce, tomato paste, even juice. Watermelon and pink grapefruit are other good sources.
Good tomatoes.
Mm?
Interesting. What else?
Pomegranate juice is another one often mentioned. It's packed with antioxidants like ellagic acid. Some studies suggest it can slow tumor cell growth and even slow down the rise in PSA levels in men who've had treatment, but the cancer is recurring.
Wow. Pomegranate juice.
Also, berries, strawberries, blueberries, raspberries are loaded with antioxidants. And fatty fish like salmon, mackerel, sardines. They provide those crucial omega-3 fatty acids, which are anti-inflammatory and have shown anti-cancer properties. Good for overall health, too.
Salmon and berries. Good staples.
Absolutely. Then there are nuts, especially Brazil nuts, which are high in selenium, and others like walnuts and cashews, which are good sources of zinc. Both selenium and zinc are vital for prostate health. Zinc actually inhibits a key enzyme involved in prostate enlargement, BPH.
Nuts for zinc and selenium.
Okay. And allium vegetables, think garlic, onions, leeks, chives. Studies have linked them to a reduced risk of enlarged prostate, and they might help prevent prostate cancer, too.
Garlic and onions, easy enough to add in. Now, you mentioned conflicting information sometimes. Can you give an example?
Sure. Take cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, kale. They contain amazing phytochemicals like sulforaphane, which generally seem fantastic. They've been shown to target and eliminate damaged prostate cells, which sounds great for cancer prevention.
Right. Sounds very good.
One source we looked at suggested maybe limiting these if you have certain hormone issues because of compounds called glucosinolins possibly affecting hormone production. It's a nuance.
Okay. So prevention advice might differ from management advice.
Exactly. Another example is citrus fruits. Oranges, lemons, grapefruit, high in vitamin C, generally associated with reduced cancer risk. But if you're already dealing with urinary symptoms from BPH, the organic acids in citrus can sometimes irritate the bladder and make those symptoms worse.
So it depends on the context, prevention versus symptom management.
Precisely. The key takeaway for overall prostate health remains strongly leaning into a diverse plant-rich diet. But if you have specific symptoms or sensitivities, that's where personalized advice from your doctor or a registered dietitian becomes really important. Don't just rely on generic lists.
That makes a lot of sense.
Yeah.
Okay, so we've covered foods to embrace. What about foods to limit or actively avoid for prostate health?
This is also crucial. Top of the list is usually red meat and processed meat. High consumption, particularly of things like sausages, bacon, deli meats, and even just lots of beef or pork, is strongly linked to an increased risk of prostate cancer, especially the more advanced forms, and also BPH.
Why is that?
The thinking is that animal fats and proteins might vigorously fuel prostate cancer cell growth. And cooking methods matter. Too burnt or heavily charred meat from grilling or barbecuing contains compounds that are particularly concerning.
Okay. Limit red and processed meats, especially charred. What else?
High-fat dairy products, things like whole milk, cheese, maybe some yogurts, butter, they might contain hormones or growth factors. Also, very high calcium intake, often from dairy, can potentially interfere with zinc absorption, which isn't ideal for the prostate.
Introduce dairy, too.
Also, sugar and sugary drinks. These spike your blood sugar, can lead to insulin resistance over time, increasing diabetes risk, and diabetes tends to worsen DPH and urinary symptoms.
Cut back on the sugar. Standard health advice, but relevant here, too.
Definitely. And watch out for excessive omega-6 fatty acids. These are found in many processed vegetable oils and lots of processed foods, margarine, chips, pastries. We need some omega-6s, but our modern diet is often way too high in them compared to omega-3s, and that imbalance promotes inflammation, which is linked to cancer risk.
So getting that omega-3 to omega-6 balance right is important.
Very. Then there's alcohol. It can irritate the prostate directly, increase inflammation, and worsen urinary symptoms if you have BPH. High consumption, particularly of beer, might increase prolactin levels linked to BPH risk. And importantly, if cancer is present, alcohol can potentially increase its growth and spread.
Moderation is key. Or avoidance if symptoms are bad.
Yes, and a few others often mentioned for symptom management specifically are spicy foods. Capsaicin can irritate. Carbonated and caffeinated beverages, they act as diuretics, irritating the bladder, increasing urgency. Excessively salty foods can cause fluid retention, worsen urinary symptoms, and sometimes refined starches like white bread, pasta, white rice, high glycemic foods associated with increased BPH risk.
Okay, quite a list to be mindful of. So the powerful, consistent message across these dietary sources really seems to be lean heavily towards a plant-based diet.
Absolutely.
The more rigorous approaches, maybe vegetarian or macrobiotic, show the biggest impact on reducing mortality in that study you mentioned. But even halfway measures, like a Mediterranean diet, are clearly beneficial.
That's right. It's not necessarily all or nothing. Moving in that direction makes a difference.
And it's fascinating that these dietary changes can sometimes even help stabilize or lower PSA levels in men who've had surgery but are experiencing a recurrence. It shows diet's ongoing role.
It really does. The takeaway is clear. Be proactive, be informed. Just having this information provides, I think, a certain degree of confidence. It helps you face whatever might lie ahead, whether that's managing your risk or navigating a diagnosis if it comes.
And knowledge is power, but it's also just as important to acknowledge the emotional side of things, right? A prostate cancer diagnosis can bring a lot of anxiety, depression.
Absolutely. That's a critical piece of the puzzle. Many men experience significant emotional distress. Reaching out is so important, whether it's to formal support groups, talking with friends, family, a partner, or even finding personal coping mechanisms that work for you, like music, hobbies, laughter, exercise.
Yeah. Breaking through any stigma or fear about seeking help is vital. Don't go through it alone.
Please don't. The support is out there. And this brings us perhaps to a final, maybe slightly provocative thought to leave people with.
Okay.
Given that we know most men will develop some form of prostate cancer cells as they age, many without even knowing it, and that most diagnosed men will ultimately die with the disease rather than from it, maybe the critical question isn't just about how to avoid it entirely,
But more about
understanding it, managing it proactively if it does arise, and focusing on maintaining the best possible quality of life throughout the entire journey. It's just the perspective a bit.
That's a really powerful way to frame it. Focus on proactive management and quality of life. Thank you for that insight and for walking us through all of this today.
My pleasure. It's such an important topic.
Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Say channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can also use it.